The other area that we have spent a lot of time on is to ensure we can increase our testing capacity. And those of you who have been following what we've been doing with testing, you would know some of the challenges that we have had, and you would know of some of the solutions that we have tried to implement to fix them. Not so long ago, our capacity to test, to do PCR tests was probably about 60 tests per day, which took about 9 hours to do. We have been able to improve that situation a little bit. There's still a long way to go. We are now doing 3 shifts at the National Public Health Reference Lab, and when everything goes smoothly, we are able to do maybe between 250 to 300 tests per day. Sometimes there are varying hiccups, and as they pop up, we try to address them. But definitely we are doing much more testing with the current equipment that we have. We recognize that the processing period that it takes, it's quite long. In some cases, it goes up to about 9 hours, and that's too long for us to be able to process these samples. So the government has taken a decision, and we are in the process of procuring an automated system that should reduce the time to about 2 hours so that we can process much faster and we'll be able to do many more tests. As you would have known from the various press reports, we have been reporting to you that maybe about 2 or 3 days ago we had a backlog of close to 1,900 tests. We are trying to clear that backlog. So apart from what we are doing in terms of processing at the National Public Health Reference Lab, we have had a collaboration with CARFA. We had sent out 500 samples on Monday to CARFA, and we are expecting those results to come back by today. On Monday, we are going to send another 500 samples to CARFA. So they would have, in the 2 weeks, been able to process close to 1,000 samples for us. This would help us to reduce some of the backlog, and hopefully we would be able to now have a faster turnaround time. In addition to that, we have started to streamline things at the National Public Health Reference Lab itself. And we are hoping that within maybe 2 weeks or so, that we can have additional machines deployed. So not only are we trying to get faster machines, but we'll have 2 other lines that we are hoping to deploy. But for this to work, the limiting factor here is the installation of some biohazard cabinets. We have procured the cabinets and they are in the country, and we are in the process of installing them. The installation, however, would have to be certified, and that certification we have to bring a specialist from abroad to certify. We have already made contact with the people who certify these cabinets, and we are now making the logistic arrangements for them to come into country to be able to certify these cabinets. Once that is done, we'll have at least 3 machines that would be working, and we have the trained personnel already to be able to do the testing.